Hi, my name is Jen, and I'm an advanced standing social work student, and I work for the Halton Catholic School Board as an educational assistant. I'll be your host tonight discussing Module 5, Mental Health Promotion. To bring it to everyone's attention, we'd like to remind you that we aren't professionalized in mental health promotion, and the purpose of this podcast is to have an open discussion about mental health and our experiences. Joining me tonight will be Toyo, Afira, and Kayla. Just to get to know my colleagues, Kayla, please introduce yourself.
Hi, as you know, my name is Kayla. I'm a registered nurse and I've been working for 6 years. I work in the emergency department and I'm doing my degree. So I'm doing the continuing education post-diploma nursing program.
Thank you for the introduction, Kayla. Next up, we have Afira.
So hi, my name's Afira, and I'm in my 4th year of the 4-year collaborative nursing program at TMU. And I am also currently working as a clinical extern on a surgical floor.
Thanks for your introduction, Afira. Lastly, we have Toyo.
Hi, everyone. My name is Toyo. I'm currently taking the Occupational Health and Safety program at Toronto Metropolitan University. I work in the rail industry as the health and safety specialist, and I've been working for over 7 years.
Thanks, everyone, for the introduction. Let's get into it. What is mental health to you?
Jen, that's actually a great question. To be honest, I never understood the concept, or it wasn't a focus in my life or in my family until the pandemic. So mental health for me now means having total control of my psychological as well as my emotional well-being.
I totally agree with you, Toyo. The pandemic has made me realize how important it is to take care of my mental health and physical health. During the pandemic, many people struggled to take control of their health.
Afira and Toyo, you made excellent points. It's evident the pandemic has affected us all. The module talks about terminologies to use and avoid. It highlights mentally ill persons and suggests using person with a mental illness. Kayla, what is your take on this?
I think that separation between the person and their mental illness is essential to promote acceptance. I think that labeling people as a diagnosis causes even more isolation, and it can make the stigma of mental illness even worse than it already is. In my line of work in the emergency room, we would never refer to a patient as a UTI, as a urinary tract infection or a pneumonia. We would refer to somebody who suffers with said diagnosis. And I think that in the mental health world, we need to keep that into account so that people don't feel like something is wrong with them. They have a diagnosis, and it's just a better way of saying it without being as, I guess, insulting almost in a way. I think it's just better for acceptance.
Kayla, you make a great point, and I just actually want to give an example just to emphasize what you just said between the separation between the person and their disability or the mental illness. This example, so I'm from Nigeria, and in Nigeria, usually a person in a wheelchair, we call that person a disabled person. But when I moved to Canada 15 years ago, I was informed that the proper terminology is not a disabled person, but a person living with a disability. So basically, your disability does not define you.
Thanks for sharing your personal experiences with us. The module talks about the determinants of health and versus mental health. What is your perspective on this, Kayla?
In the module, one of the required readings was the article, A Framework for Supporting Action in Population Mental Health. Included, basically it had information regarding the determinants of mental health. So these are different from the original determinants of health that we already touched on in previous modules. And the determinants of mental health are classified as risk factors and protective factors. And the article continues to describe these two things. So in the protective factor, they say it's the increased ability to cope with adversity, moderate stress, and the risk factors would be anything that would make you more at risk for developing a mental illness. So it talks about also 3 types of effects related to stages of life when people are exposed to risk factors, one of which was exposure during critical or sensitive periods of life, and how that will affect them in adulthood. So it could even be in early childhood. People are in a more critical or sensitive period of life. Social positioning, which varies along the lifespan as well, and exposure to risk or protective factors accumulation throughout the lifespan. So, I think what they're touching on is, say, if you're under stress your whole life, eventually I think it would catch up to you. And then if I go into it a little bit more, an important risk factor of mental health or determinant of mental health in the risk factor category can be poor socioeconomic conditions during a sensitive period of life, such as, like I mentioned before, early childhood development. Say you live, in a poor household and you don't have food security. Your parents are stressed out constantly, unstable living conditions, maybe even violence, etc. These will have detrimental effects on your mental health and your mental well-being.
Kayla, I like how you mentioned the risk factors, but we have to remember to consider the protective factors of mental health as well. This includes good social support. Having family or friends that support you and are there for you can be beneficial. Other ways social support can help is by increasing meaningful connections and creating a safe environment for individuals.
Thanks for that. As we finish up our podcast tonight, I wanted to hear how each of you are taking care of your own mental health.
So I would actually go first. For me, I think the most important thing after the pandemic that I'm focusing on now is health literacy. For me to be able to educate myself and empower myself with the skills, for me to recognize, the symptoms when I'm at work, where I spend most of my day, and being able to recognize for my colleagues as well as my family members, just recognize the symptoms of stress and being a support, whether it's social or emotional. That's definitely something that I've been doing, and it's an ongoing process. Um, so that's definitely, the way I look at it when I'm trying to, educate myself more on mental health. Yeah.
Amazing. What about you, Afira?
So, one thing I've learned while working in the healthcare system through this pandemic is the importance of mental health and overall well being. So, one way that I've been taking care of my mental health has been through taking part in wellness initiatives run by my workplace. So, throughout the month, my workplace runs multiple different activities and events to help staff de stress. Most of the events focus around mindfulness-based stress reduction, which was one of the non-pharmaceutical therapies mentioned in our module. So some of the activities included paint workshops, sound therapy, meditation, puppy therapy, and massages. By attending some of these events, I was able to step away from the busy work environment and was able to relax a little bit and de-stress.
That's awesome. I love all of that. Kayla, could you finish us up?
Yeah, actually, I started running recently, and I feel like it really gives me a time alone from family life and school and every other stressor work. It really gets you alone, and you get to concentrate on the movement. And I think it was touched on in one of the podcasts. Exercise is medicine. It really clears your head. Like, I can't stress enough how much running has really helped me mentally. I find I'm less angry. I don't hang on to things as long. I communicate better. It's been really beneficial for my mental health and just checking in with myself. It's something I guess it would be part of self-care, a very good part of self-care for all of us. All the examples we gave, we're taking care of ourselves.
That's awesome. Thank you. Kayla and Toya and Nafira. That was amazing and very insightful. Thanks for joining us tonight. Until next time.